Hi, my name is Victoria Hoel, and I'm a Marie Curie Early Stage Researcher Fellow at the University of Bremen in Germany. And I'm here today to report on our research around the impacts of COVID-19 on German nursing home residents with dementia, the availability of social activities for these patients, and how technology was used to mitigate the COVID-induced social isolation. So, social health of nursing home residents with dementia has undoubtedly been impacted by COVID-19 due to disruption of social activities and visitation access. Consequently, the frequency of problematic behavior might increase, as this has been linked to unmet psychosocial needs. With in-person social health strategies severely impeded, technology might be a viable alternative to mitigate the adverse effects of the pandemic-induced social isolation. To assess the impacts of COVID-19 on nursing home residents with dementia, we analyzed cross-sectional data from a follow-up questionnaire nested in a larger national online survey conducted during the second wave of the pandemic in Germany. In addition to structural characteristics, the scope of this research included questions on clinical outcomes, social activities, and technology to promote social participation among residents with dementia. The survey also contained open-ended questions where participants could give recommendations of what conditions need to be met for technology to promote social participation and meaningful activities for care recipients. The quantitative data was evaluated descriptively using frequencies, mean values, and chi-square independence tests, while the free text responses were subjected to an inductive thematic analysis. So, luckily, our findings showed that there was an overall low increase of pharmaceutical therapy for nursing home residents with dementia, observed in less than 5% of the facilities. But a large proportion of the respondents saw an increase in at least one behavioral and psychological symptom among residents with dementia, with depression and anxiety being the most frequently reported. And more than a third of the respondents reported that social activities for care recipients with dementia were canceled during the pandemic. And unsurprisingly, this was correlated with whether the staff or residents had lab-confirmed COVID-19 cases among them. And the staff shortage of more than 5% also showed a significant association with social activities for residents with dementia being cancelled. Less than 6% of the German nursing homes had established procedures of using technology to promote social participations for the residents with dementia, but nevertheless, almost 2/3 reported having provided additional opportunities for these patients to use digital technology for social contact with friends or family. And when analyzing the free text responses, requirements to promote social participation for care recipients using technology were identified at the micro, meso, and macro level. Within the micro level, three sub-themes emerged: user capabilities, user willingness, and family support. At the meso level, the organizational requirements could be divided into three parts: tech support, training, and sufficient resources. At the macro level, the main requirements identified were related to cost coverage and network infrastructure. During and beyond the COVID-19 pandemic, non-pharmaceutical solutions to promote social health among nursing home residents with or without dementia should be an integrated part of caregiving procedures. Considering what we know of the adverse consequences of social isolation, keeping technological options available is crucial in disruptive events such as a viral outbreak. As mentioned, a staff shortage of only 5% was significantly correlated with social activities for residents with dementia being cancelled, revealing how easily neglectable social health strategies for nursing home residents really are. Established procedures and training of staff is needed, but the work of developing and implementing technology to promote social participation is facing substantial barriers as long as social health is not recognized on equal terms as physical and mental health domains. I therefore wish to take this opportunity to invite you to take on the important task of promoting social health at the societal, organizational, and individual levels. If you have any questions about our study or wish to discuss social health and technology for people with dementia and their caregivers, feel free to contact me via my email or through Twitter. Thank you so much.